Hello and welcome to the Posture Dojo podcast. My name is Sam Miller and I'm your host on this postural transformation journey, sharing stories, experiences, therapies, and methods in my own healing journey of an 85-degree kyphosis scoliosis, and speaking with experts from a variety of fields that can contribute to this conversation around achieving pain-free and powerful postures. Today, I'm very excited to have Dr. Dennis Woggan on the podcast. He is a chiropractor and is certified with the Clear Institute. Dr. Woggan, please introduce yourself to the Posture Dojo.
Good morning, Sam. Thanks for having me on the show. I'm in St. Cloud, Minnesota. Graduated from Palmer College of Chiropractic in 1974, so this is my 50th year in practice. And I actually started teaching classes in spinal biomechanics in 2000 and it's been a long time, 1976. And then I started focusing on scoliosis in the year 2000. Scoliosis is probably one of the most difficult things to work on, but once we understand the spinal cord and how that functions relative to the spinal column itself, it starts to make a lot of sense.
So this is you've seen the whole approach to scoliosis evolve. Where was it when you first started, and where is it now?
I actually figured that chiropractors should be the spinal experts when it comes to the spine, and yet the training that we get in chiropractic college is very limited. So I started doing research in scoliosis probably right around 2000. So it's been a while. I did a lot of research and studying and trying to figure out how the spine works. And if we understand how the spine works spinal biomechanically, then we can actually correct it spinal biomechanically. And that's without bracing and without surgery. I'm going to switch here.
So many. I'm very excited about this conversation because, with your experience, your studies, with what you're doing at the Clear Institute, which I would say is one of the leading alternative treatment methods beyond the surgery and the braces. Obviously, the phase of the conventional medical approach that I went through, which was very early in the 2000s, when I was a late teenager. I experienced a system that identified the degree of my curve. Bracing wasn't an option. Surgery wasn't an option, as it was a very severe kyphosis scoliosis. And beyond that, I wasn't really presented with options. It was, it's just you're going to live with that. The alternative methods were still too woo-woo, still too out there, so they weren't really formally presented to me in that situation. That's the kind of phase that I went through in the very early 2000s. Now, at that time, we didn't have a confirmation of this asynchronous neuroosseous development, where you have this different growth rates of the spinal cord and the spinal column. Although Dr. Roth had proposed it in 1969, it hadn't really been confirmed by Dr. Chu, I believe it was, in 2008, when he started doing MRIs and noticing that the spinal cord was a different length than the spinal column in idiopathic adolescent scoliosis. And so, that theory or that understanding wasn't really integrated into modern medical approaches, but it sounds like it is in your approach.
Yeah, that's actually called the Dalmas Index, as far as being able to measure the fully extended length of the spine compared to the normal spine.
So you've got a presentation. For people listening, I do recommend heading over to the YouTube channel for this episode. You'll find the Posture Dojo on YouTube. Dr. Dennis Wogan has prepared a presentation that will be walking through what he refers to as spinal hygiene. So Dennis, if you switch applications, on your computer, you can go to the PowerPoint, and the screen recording will be presenting what you're showing.
Good.
So on
Can
your
you
PC,
see that screen now? It's
so
clear.
we can see that. We can see that. So we see human body systems.
Yeah.
And, obviously, what my in summary, the approach that the medical system I went through was looking at the spine in a very physical way. And we obviously now know that, this to approach scoliosis and hyperkyphosis, it's about way more than the spine. So it looks like this is what you're referring to here.
Yeah, exactly. When we look at the body, there's 9 different systems. We've got the immune system, digestive system, cardiovascular, integumentary, respiratory, endocrine, reproductive, excretory, musculoskeletal, and the major one is the nervous system. The nerves control everything in the body, um, and there is a communication between the brain and the body. Now, when we look at the spine from the side, there should be a curve that goes forwards in the neck, backwards in the middle back, and forwards in the lower back. When we start to look at this, when the body loses the good curves, it actually causes bad curves to come in. So here we have quite a bit of forward head posture, okay, where the head is out in front. Um, and that would be similar. If I take a
Yep.
shot put and hold it like this, it has a certain amount of pressure. But when I hold it out, it actually feels heavier. So normally the head weighs 10 pounds. When we have forward head posture, 1 inch actually doubles that to make it feel like it weighs 20 pounds or 10 pounds more. So when I bring it out to the side, if I turn it upside down, see how the elbow comes out to the side? So when the body loses the good curves, it's going to put in bad curves. And that's what we're seeing here then on the right side where it starts to go off to that side. Um, those curves are very important. When I look at the neck from the top, there's actually 5 curves in the body. The center mass of the skull is in front of the atlas, and the atlas is the very first vertebra. It holds up the spine, just like in Roman goddess, the Roman god holding up the head. So the atlas holds that up. Then we got a cervical lordosis, that's 2 curves. Then we got a thoracic kyphosis, 3, lumbar lordosis, 4, and then the sacral area down here, which comes forwards, which is 5. Now, engineers tell us that the number of curves squared plus 1 equals resistance. So what we're looking at here is 5 squared is 25 plus 1 is 26. So it's actually the curves that give the body strength. They make it a lot stronger. You can have somebody who is a big weightlifter, he can bend over to tie his shoes and he throws his back out. Well, it isn't the musculature, it's the amount of curves that's in there. And that's what really starts to change everything.
Yeah, these curves are designed as natural, force producing and absorbing springs that transport our essentially our brain around the planet, right?
Yep, exactly. Um, when we look at the spine from the side, there's supposed to be a forward curve in the neck, backwards in the middle back, forward in the lower back. Then we've got the head in front, and then the sacrum comes down. So when we're looking at those curves, okay, we've got a cervical curve, thoracic curve, lumbar. Now, when the body has that forward head posture, it loses the good curves. And then what happens, it puts in bad curves to compensate to that because the body has to relate to gravity. So that's where we start to see the scoliosis. And scoliosis is really interesting. It's present in about 4% of children. But when we look at the general population, 1 out of 3 people actually have scoliosis around the age of 44. By the age of 62, 68% of the population has scoliosis. So it's really epidemic when it comes to scoliosis.
I believe every kind of cause is slightly different, but we do have to kind of consider what was the emotional, psychological effects and the environmental effects of how someone grew up. What's your answer when you say what causes when someone asks you what causes scoliosis?
Well, it's called AIS, adolescent idiopathic scoliosis. And idiopathic means I'm an idiot and I really don't know what's causing it. There's a lot of different ideas out there, everything from hormones to trauma, um, to a lack of normal biomechanics. Here we can see a curve in the upper back, and we actually have a scoliosis chair that we
Mm-hmm.
use to help correct that. Now, what the chair does is it pulls things into position instead of pushing things into position. We talked about the atlas, and the atlas is really important. MRIs don't show that area. And the one thing that we're looking at here is the vagus nerve. Right in that upper neck area by the vagus nerve are the spinal cerebellar tracts, and they control the muscles in the body. So when we get pressure on that vagus nerve, it affects all parts of the body. As a matter of fact, with the vagus nerve, it's the largest autonomic nerve in the body. It can affect the heartbeat, it can affect the lungs, it can affect the intestines and cause constipation, all kinds of different areas. So this upper cervical area is extremely important. One thing I want to bring into play here is the way that we have a tendency to abuse our bodies, especially with antibiotics. And I don't know if you've ever been to Mexico, but they have pharmacies there that will sell just about everything. One of the major things that they sell here on the right side is Cipro. Now, Cipro is a fluoroquinoline, which is an antibiotic, but is fluoride based. There's different names to fluoroquinoline. There's Cipro, Levaquin, Tequin, Avalox, Fluoxetine, and Naroxen. The problem with that is fluoride is a poison. It is really bad as far as the body goes, and it destroys the collagen in regard to the body. Now, ligaments and tendons both have collagen. And if we look at this on the right, this would be a tendon or a ligament, then the fascicle, then the fiber, then the fibril. And the very center, the core, is the collagen. And what fluoroquinolines do, okay, is they actually called apoptosis or death of that collagen. So that's why you get someone who's taken a fluoroquinoline, something like Cipro, and all of a sudden they're walking and their Achilles tendon just pops because that whole thing. So we're looking at areas that we're going to check out as far as working with fluoroquinoline. The big thing with fluoroquinoline is it's a black box medication, a black box antibiotic. What that means is you should only give it like Cipro or Levaquin if it's a matter of life and death, because it has such bad side effects. So anytime that you take an antibiotic, find out what it is, and if it happens to be Cipro or Levaquin or any of these other ones, don't take it. It's extremely harmful for the body. But most of us will get an antibiotic and we have no idea what it is. Okay. So we can actually look at the spine from the back, and we can see how the right side is much better from a cosmetic point of view. This is a patient that went through about 2 weeks of treatment. Okay. So we are able to reduce and stabilize the scoliosis. So 24 went down to 7, and then 51 degrees went down to 34 degrees. When they do scoliosis surgery, they expect maybe a 50% reduction, and that's it. We also do like lateral bending x-rays so that we can see where the flexibility is. And there's a forward bending test that we do where we take what's called a scoliometer and run that along the back of the back to kind of see there's a little BB in here.
Yeah, the forward bend test. How old was that patient? You saw the improvement?
That patient was 33 years old. So it's not just for kids. It works really well on adults. But using the scoliometer is probably the best way to do it. This is kind of my theme song, my motto. At the point in your life where your talents meet the needs of the world, that's where God wants you to be. So I really think that God gives us various ideas, especially when it comes to helping people, and we just have to be open to that. We talked about the ligaments, and one of the major ones is the alar ligament. It's a ligament here up on top that goes from the second vertebra, the axis, up to the occiput. So it skips the atlas, and the atlas is kind of like a differential on a car. When you go around a corner, the outside wheels go faster than the inside wheels. So what that is like the great balancer, the great equalizer. And there's no disc in this area, so MRIs don't show anything with this. When we look at it from the side, we can actually see slippage as far as the ligaments go, and that's known as a loss of motion segment integrity because ligaments hold bone to bone. So when we get ligament laxity, we see that in scoliosis patients in an epidemic amount, simply because those ligaments aren't functioning like they're supposed to do. And this type of a cervical spine should never be adjusted manually or by hand because it stretches the ligaments. So it only should be done with a adjusting instrument. This is an example. What I've got is a digital motion x-ray machine. It takes 30 x-rays in 1 second, but it's 1/1000th the normal radiation. And what that does, it allows me to see how this whole thing functions, just like a movie picture. So we can watch this here, and this is the top vertebra of the atlas, seeing how that functions. There's a complete loss of curve. We can see slippage in here relative to the posterior longitudinal ligament. It just gives us a real good idea as far as where the ligament laxity is, so that we can actually turn around and do specific spinal isometric exercises to stabilize that area. And here we're looking at it
This
from
is
the front.
amazing. So, this part of the body for me is a massive point of focus and attention for me. I mean, for a number of reasons. The jaw, my tongue position, my jaw. I'm noticing the deep connection that has with our pelvis and our entire posture, obviously. And then also that that sub occipital kind of area at the back of the head. That's really where our brain and brain stem it can be felt. Even our eyes, you can feel the eyes in that area connected to that part. And
Yep.
if we're in a situation or an environment that requires a fight, flight, freeze type reflex, whatever that may be, some type of response to the environment, some type of tension to protect, that is going to be triggered from this area and sent through the spinal cord and the nervous system. So whether it's myofascial release or relaxation in that area, I think it's a core point of attention, because if you've got a control panel that is sending out signals, the signal is going to be the strongest in that area. So I've been really paying a lot of attention to this part of the body, because I know that's as close as it gets to ground zero, I feel, for a lot of people when it comes to the chronic patterns and signals that their body might be holding.
Yeah, it's called CCI, cranial cervical instability. And there's been a lot of work done on this in the last 5 years. I wrote the first paper on the alar ligament instability in 1985. So going back to that spine, when we look at it from the side, okay, so the left side is the front, the right side of the back. The spinal cord goes through the spinal canal. So the spinal canal is the home where the spinal cord lives. And where you live is pretty important. So the problem is when we start to lose that curve, notice how the spinal canal gets longer in here. It actually increases 24% in distance. Now imagine taking your finger and pulling it 24% longer. Not what you want to see. Now, the next thing around the brain and the spinal cord is the meninges. You've heard of meningitis. It's a sock-like covering that goes around the spinal cord. But the meninges is made up of diagonal fibers. So what happens is when it becomes straighter, it actually has a pincher effect. So not only is this being stretched 24% in distance, it's been squeezed with 30 to 40 pounds of pressure at the same time. Kind of very similar to taking your finger and sticking it into your eyeball. Okay? That's a lot of pressure, and the nerves there are 6 times more sensitive than your peripheral nerves. Again, that goes back and really affects the cranial, the vagus nerve. One thing that we want to look at here is to be able to correct that cranial nerve. So
Okay.
the one thing that I've got here is just like a simple pair of glasses. And what I've done is I've put tape on the very top of the glasses. So when I do that, and this is something you can do at home, we'll put the glasses on, and because of the tape, automatically I'm going to bring my chin up, and that's going to reduce the forward head posture and improve the cervical curve. So you just take a pair of sunglasses, any kind of glasses, put tape on the very top of them. Okay. right, like that. And that automatically makes you keep your head up. And you want to do that for 15 to 20 minutes, say twice a day, to actually get that whole spine to
I've
come into
actually
position.
I've done that. I recommend this to bring not only the benefits that you'll see during that 15-20 minute practice, but also just the awareness that the angle that you have of your eyes and the back of your head are really determining your posture in a lot of ways. Something
Yep,
that's overlooked in a lot of these postural correction exercises. You'll see it's not just your chin position here. It's really how your eyes in the back of your head are leveling, and then because the rest of your body will compensate. Whatever you
right.
think, if you think you're looking straight ahead, but you know, especially with the phone posture as well, that's a really important awareness to bring into your body.
And the eyes are the major writing reflex of the body. They tell the body where it's at. So there's 5 different writing reflexes. There's the eyes, there's the ears, so you get dizzy sometime. Then there's neck and body writing reflexes, one in the neck, two in the body. Kids that are blind have a 5 times greater incidence of scoliosis than kids that are deaf, who have 2.7 times less incidence of scoliosis because they rely upon that writing reflex of the eye so much. Now they have alternatives to that upper
Hmm.
cervical area. I'm sorry, go ahead, Sam.
No, I was surprised. That was an
Okay.
expression of surprise. I haven't heard that one before. Makes a lot of sense, though.
So what they do now, what they're actually looking at is the type of surgery where they would go in and fuse the bottom head bone, which is the occiput, to the atlas to the axis. Now, it's like having a six-cylinder car and fusing 2 of the cylinders and expecting the car to run better. It's just not going to happen. But when it comes to surgeons, everything looks like a hammer to them. There's another area that we've been working on, and that is working with a Dr. Ron Hansen, who's down in Minneapolis. He's a medical doctor that does a lot of work with injection therapy, such as prolotherapy, which is a dextrose to sugar solution that tightens up the ligaments. PRP, which is protein-rich plasma, where they take your blood out and separate the plasma and inject it back into the spine. So you're using your own body to heal your own body. And what that does then is actually allows these joints to become more freely movable in areas where they're stuck. Um, then the other
Hmm.
area is as far as getting that curve back into that neck. So I've come up with a way here by utilizing weights. Human beings adapt in time and need to their environment. So here's a loss of a curve. And then we use a hood weight and a chest weight on this patient. See how I brought the curve back in there? So to do that for 15 to 20 minutes twice a day, to use sensory motor reintegration to get that curve back into that spine. Now, one other thing I want to go through that's really important, and what I'm trying to do is make this for things that you can do at home. So the glasses are really important.
Sure.
After puberty, the blood
Could you
supply
walk
that
me through
goes,
the hood weight? Sorry, just before we move on there, could you walk me through the hood weight and the chest weight? How does that exercise work?
yeah, it's actually, yeah, okay. So there's a weight that we wear on top of the head that hangs backwards, and then there's a chest weight that hangs frontwards. So we get a force and an opposing force. By doing that, the head goes backwards and the neck comes frontwards, and then we're allowed to change. Okay.
So it's a heavy necklace, and you've got
It weighs
a
about 3 pounds. It depends upon
basically
the
a kind of
patient
a
and how big they are. So it can weigh anywhere from 3 pounds to someone else might weigh 10. The weight might be 10 pounds. So
and
this is
that's
three
that's
and
kind of
five
at the
pounds,
where your collar
and
would
that's
be
how
on
it
a
weighs.
shirt. That's kind of where that force is coming in forward, and then you've got a weight around basically the forehead, where the strap of a beanie or a hood, yeah, beanie kind of beanie hat. That weight is kind of strapped around the forehead and pulling back. Have I got the tensions right there?
Yeah, yeah, actually, you do. I spend a lot of
Yeah.
time teaching, so I spend a lot of time in airports. And if you watch somebody carrying a shoulder bag, what they do is if they got the shoulder bag on the right shoulder, they're going to lean to the left side. Unless it's really heavy, then the force is going to overcome it. So when I saw him reacting and leaning to that left side, I realized that's how to get the body to react in time and need to its environment.
Beautiful.
Yeah, it's something that's really kind of
Please
revolutionary,
continue.
and but it's able to actually rehabilitate that whole curve area, which is exactly what we want to do. Okay, moving forward, after the age of puberty, the blood supply that goes to the disc atrophies and disappears. It's part of the normal aging process, just kind of like losing your baby teeth. So what this does is it starts to change the body. Now the blood supply brings in nutrition and it takes away waste products. So when you stop feeding something and stop cleaning something, it starts to degenerate. But it doesn't give up to us on us after the age of 25, or after the age of puberty. What actually happens here, all right. So what happens is motion is very important to get that fluid into that disc. So what the patient does is they're going to sit down, bring their arms up when they're sitting, and they're going to turn to the left, to the right, to the left, to the right, and they're going to do this at least 25 times or their age. So I'm 73 years old, so I'm going to do this 73 times. What that does, it increases inhibition and osmosis. It's like if I have a sponge and put it on the top of a bucket of water, it's just going to sit there. But if I push it down and squeeze it, out with the bad, in with the good. So this is like a spinal hygiene exercise. Everybody should be doing this like every morning and every night to help fade and cleanse the entire disc area. It's like if you're going to brush your teeth, it's easy to get a false tooth. It's not so easy to get a false spine.
Right. So you're
So then after they do
hydrating,
that,
rehydrating.
yeah, after they do that, now they make Jello out of ligaments and discs from cows and pigs. They don't do it because it tastes good. They do it because it has what's known as hydrogel properties. So you take your Jello, put it in a little bowl, put some hot water in it, stir it up, and then you put it in a Jello mold and put it in the refrigerator for 14 and a half minutes. And after 14 minutes, it goes from a hydrosol, a water stage, into a hydrogel stage. So then we have them lie on a cervical and lower back roll to actually mold those curves in there. And it's simple to use. All you need is a bath towel, a fairly small one. You're going to fold it in half, and then you're going to fold on the side so there's about an inch in the middle, and then roll it up. That gives us a center area that's softer so that the spinuses, the little bumps on the back of your neck, will fit in there. And then you lie on that for 14 and a half, actually we'll do 15 to 20 minutes. And what that does, it actually molds that curve into position. So along with the spinal weighting, as far as the head goes, we do the spinal twist exercise, and then we do spinal molding. And that molding will actually keep that curve into your neck all night long because there's usually a lack of motion in there. But it works fantastic. So we do it first thing at night when you go to bed to mold it, and then in the morning when you get up, just like you're going to start the game of life, you're going to want to warm up for that. So we do the spinal twist exercise in the morning again. If you get dizzy by doing this exercise, it's because you have your chin down too much. So you've got to keep the chin up higher. And then by doing that, it's possible to actually start to change all this as far as the curves go. So this is a 24-year-old male, 27 degrees. Well, 27 degrees came down to 4 degrees, and 23 degrees came down to 0.8 degrees. This is without surgery, without bracing. This is done with exercise, vibration therapy, very specific spinal adjusting. Again, no popping or cracking of the neck, to actually change the whole thing as far as the spine goes. Now, we also go into a complete dietary thing. A lot of times you'll see farmed Atlantic salmon, and usually it's on sale. Well, guess what? There's no salmon in the Atlantic Ocean. They're only in the Pacific Ocean. So if it says farmed Atlantic, this is farm-raised fish. Anytime you see Atlantic, it's definitely not fresh caught fishes, which we should have. The other thing that's really bad is wearing high heel shoes. It cramps the feet and it actually throws the head forward and increases forward head posture. We can do a lot of things with the digital motion x-ray, including looking at the shoulder area. There's actually an exercise that I came up with a number of years ago. I flipped a snowmobile, did an AC, acromioclavicular injury. It's what has a stage 4, so that's when they actually do surgery. So I came up with an exercise here to bring that AC joint into position. Like I said, they wanted to do surgery. I did this exercise and never had to have surgery. So again, we can see the motion in there, exactly what we're looking for, what abnormal motion is. And then here's the atlas again, and being able to find instability. You know, when we look at function is more important. Kirkcaldy Willis is a Canadian surgeon. He said the restoration of function is more important than the relief of pain. It's not so much the pain that stops me, it's the pain that stops me from playing with my grandchildren, the pain that stops me from golfing. And when we restore normal function, then we can get all that back into position. So this is
And
actually,
so
here
it
we can
seems
see
like
the AC joint, which stands
this
for
atlas part
acromioclavicular. This should be way
of
down,
the
okay, in this area here.
so it, so it,
And by doing that band
yeah, so it
exercise,
seems
it
like you've
pulls into
identified
position.
the
It's like a large rubber band.
sorry, I think we have a
So
bit of
this is
lag, but
definitely a
it seems
better
like
way
you're
to treat
focusing on
scoliosis
the
without
atlas.
surgery, without bracing. The average kid actually is supposed to wear the brace for 23 hours a day. And I've actually tried the brace on. It's not exactly comfortable. The thing is that the purpose of bracing is not to improve the scoliosis. The purpose of bracing is to make sure that the scoliosis doesn't get worse. So let's say the scoliosis is at 35 and it stays at 35 degrees, that's considered a success. Whereas um, with what we're doing here is much more efficient. And when they do surgery, the most they can correct it is 50%. The body can only allow a certain amount of correction before a lot of the vital signs start to shut down. So what we're actually doing here, I think, is relatively new. We're really breaking the sound barrier when it comes to old ideas and new ideas. When you come up with a new idea, it takes 17 years for that new idea to trickle down to the public. There's a lot of stats that prove that's correct. Well, when you feel like quitting, think about why you started. And the reason I got into chiropractic was to help people. I worked a lot with families. I worked a lot with car accidents. And then I got bored. And so I started working with scoliosis. But I definitely have a passion. Scoliosis is not a job to me. It's a hobby. It's something that I enjoy doing. And there is an enthusiasm that goes along when you come up with something new that really helps people. The one thing you have to do as you get older, though, I would definitely recommend when you're 73 years old not to buy a 900cc Triumph motorcycle, or you're going to end up, instead of on the motorcycle, into the push cart at Walmart. Okay. This is a really interesting book by Tony Robbins. And I know Tony, I know he's kind of he pushes the limit on a lot of different things. But in this book called Life Force, he goes into various types of situations, various medical medical problems, and shows answers to those medical problems that aren't really found in normal research right now. So I think this is a fascinating book. Family isn't always blood. It's the people in your life who want you in theirs. The ones who accept you for who you are, the ones who would do anything to see you smile and who love you no matter what. That kind of fits into what we're doing. Again, this is my contact information, drwogan.com. And then being able to change these areas, avoiding surgery, which is just, it's not a good thing to do when they start fusing these areas together. And this person had ligament instability where the ligaments were very lax. So the neurosurgeon just said, well, I'm just going to go in and fuse everything together. And that's what he did. So it's actually considered a disease when we come to scoliosis. Um, Even affects that lower back as well. Stephen Hawking said the greatest enemy of knowledge is not ignorance, it's the illusion of knowledge, which I think fits in really well to what we're talking about. Being able to, now this is with the glasses on. You can see how on the top it brought the curve back in. Um, Sometimes when you get to a really bad scoliosis, surgery is the only answer. So we have to really look at this and decide, there's no way that I could help a spine that's 138 degrees. This is definitely a medical referral. So you got to know when to refer and when not to refer. Um, Dancers seem to have a higher incidence of scoliosis. Dentists have a 17% higher incidence of scoliosis. There's another thing that we're looking at right now, which is called beta globulin. It gets a little bit complicated, but it's actually, I have a patient who is a international fertilizer distributor. And in the rice paddies in the Philippines, he saw all these old guys that were 60, 70, 80 years old, but he saw that their feet looked like they were 17 or 18 years old. And when they looked at the water, there was a bacteria in there called the beta globulin, which is different than most beta globulins. And what that is, okay, it's a polysaccharide with a carbohydrate chain. And what that does is it causes the production of collagen. The reason you get wrinkles is because there's a lack of collagen. So this helps with the wrinkles. More importantly, there's a pill that the patient will take, and there's also a spray that we will use directly on the focal area. And by doing this, it really helps to stabilize the area. We can actually pick the areas on the spine where we need to use the beta globulin with the spray. There'll be a website on this. We do it in the morning and at night. And the one thing, especially with the chiropractic adjustment, question is how come it doesn't stay in place? Well, the reason it doesn't stay in place is because it's not in a situation where it's stable in that place. So I'm doing a lot of research right now relative to the beta globulin, and we'll have a website up on that shortly.
So it sounds like you're really focused on the cervical area as a place to bring alignment, which will ripple alignment through the rest of the spine, right? That head
Yeah,
angle on our body, which is the atlas like it's not quite a vertebrae,
yeah, the
right? It's
atlas,
more
the
of the
very
atlas
top
bone.
vertebra. Yeah. Now we still adjust the
The
entire spine. But if I have a patient that comes in with their head tilted off to the side, they don't walk in like this. What they're going to do with that righting reflex you mentioned, they're going to tilt off to the side to bring that head back up to gravity. See what happens from there on down? So, yeah, adjusting the
so
atlas is
you
important, but also adjusting the rest of the spine is important too. But
so we
adjusting the
lost
rest of the
your
spine
camera.
doesn't do any good unless you get the atlas in place.
So the writing reflex, yeah, our
Yeah,
body is adapted, like whatever our eyes are receiving or whatever we're perceiving of the environment, our body is just adapting to that. So the same thing that can, that same reflex that was adapting in an imbalanced way is the same way to bring that alignment in there. So it sounds like that's a really kind of key piece to what you're doing. You've shown some great results from people who have gone through various treatments. One result was 2 weeks, one was for 7 months. How do you typically work with someone, and how much in person does it require? Right, because you're based in Minnesota. How much in person treatment is required, and how much can you do remotely?
Yeah, if it's a local patient, we'll see them 3 times a week for 4 weeks, so like 12 visits, and we'll do a reevaluation, see where they were, and then see where we need to go. When we have patients that are out of state, we'll actually have them stay. We've got an apartment in my clinic. It's a 2 bedroom, 2 bathroom, fully furnished, and some of the other doctors have that as well. And in that case, we'll see them like twice a day for 5 days. If it's a severe case, maybe even 10 days. The big thing is to go to clear-institute.org.
Yeah, you're currently sharing the PowerPoint window, so we won't be able to
Yep,
see it
I am.
until you change the screen share. That's fine. We'll have the Clear Institute, clear-institute.org website link in the show description as well as your website to get in touch with you with your clinic in Minnesota. So we'll have that information available.
Yep, we got that. So it's www.clear-institute.org. And by going there, you're going to see a list of all the Clear doctors. We've got one in Panama, two in Singapore, one in Tokyo, one in China, and then a number, about probably 30 in the United States. And this is a postgraduate class. It's not just, it's a 300-hour postgraduate class. Your average chiropractor doesn't have any clue as far as what's going on with scoliosis, because like I said, they learn very minimal when it comes to classroom activity. Um, so if we're seeing them for daily, twice a day daily visits, we'll probably get them back in about a month for another week of care instead of 2 weeks, and then monitor them. They also get specific spinal isometric exercises and spinal weighting to do at home. There's a scoliosis chair that we use. Um, the average office visit in our clinic is 2 hours. It's not like you just go in and get snapped and cracked and popped and sent on your way. It's a specific regimen, not just of diet, but of utilizing whole body vibration, spinal molding. We want to get the good curves back so we can get those bad curves out of there.
Amazing. You've certainly been developing a holistic approach that I think addresses these types of curves in a way that has been overlooked for a lot. So I want to commend you and thank you for the work and the contribution that you're doing to this area. Your quotes have been very relevant. I'm curious. You shared a quote about your talent, where your talent meets what the world needs. Kind of is your calling. What is your talent in this approach?
A couple of years ago, I had a doctor that came up to see me, and he worked with me for an afternoon. And he goes, "Dr. Wogan, you sure are smart." So I went home and I told my wife, I said, "He said I was really smart." And my wife, whose name is Brenda, said, "Dennis, you're not smart, you're persistent." I think that's really the key to everything, is the persistence where you don't give up. When I first started doing this, I actually made patients worse. So I did it the opposite way, and then I made them better. Um, so it really is persistence. You just don't give up.
Yeah, I mean, and obviously, you said this is like a hobby for you. That hobby, that enjoyment of the process, is going to allow you to obsess over the details, to think about it more, to have those epiphanies come to you. While you're brushing your teeth. I think that's a the people who truly understand this on a deep level aren't just doing this as a job. They're either inherently, motivated because they're healing their own postural deformities, or they have this passion which kind of speaks through the work that you've been doing.
Yeah, yeah,
So persistence is key.
and the thing is, you're having fun. I like to have fun. When I turned 50, I said, if it's not fun, I'm not going to do it.
There
And
you
this
go.
is just so much fun being able to figure these people out, figure out, what to do so they don't have to have surgery. I would say we had probably, go all in all, close to 2,000 patients cancel their surgery because they didn't need it after we worked with them.
Amazing. Amazing. There's clearly a need for this. I'm curious what things. So you mentioned that in the beginning there were some things that were making scoliosis curves worse. I'm curious what things are you seeing people doing that might be making their curves worse?
Anything like heavy trauma, like jogging repetitively over long distances, sprinting and walking is much better. We always like to try to give them like an alternative. One of the three worst exercises are push-ups, pull-ups, and sit-ups. And the way they affect that middle back, and as far as the fact that the muscles aren't symmetrical, when they start doing those, they actually aggravate the muscles and pull the curves into a worse position. So I'm not a big
Interesting.
fan of rugby.
So the pull up for me has brought well, if I, it feels like a lot of alignment, because to be able to do that pull up, I need a lot of coordination of some of these muscles. But I guess you're suggesting that the way that the back is formed during a pull up is not the ideal curve that we're after, right?
Yeah, because if I've got muscles that are stronger on one side as I do a pull up, it's going to start to pull that side out and make it worse.
I can certainly agree with that. In my experience, when I first started trying to do a pull up, no, I guess my scoliosis is minor compared to the kyphosis. So in terms of the kyphosis, I've felt a lot of benefit as well, just through the neural muscular activation patterns that it requires to do it, and obviously doing it quite slowly in a way that it might take me multiple years to even get one pull up. It's about starting that movement and realizing where you do have strength on one side and where you're not feeling an activation in that neuromuscular pathway on the other side. And then, going as slow as you need to. And that pace might be years. But as you kind of continue and persist, you start developing that pathway and that activation. But yeah, it's certainly not. It's not kind of at the core of a postural correction exercise, but I have found some benefit into it. And just like these,
Yeah.
there's some cobra movements. There's things that you know they're advised not to do them, or like jogging, right? Like if you go for a jog, it's not bad for you. But if you're doing it repetitively and make it a lifestyle, and you're not breathing into your full expansion, and you're not providing a way up for your spine, the jogging is really going to be more of a decompressive activity or a decompressive habit, which might accentuate those curves.
Yeah.
So
And
I'm
I
curious,
think
what
the big
exercises
thing
do
is,
you like? What exercises do you recommend people start integrating more of?
yeah, the big thing is doing things that are symmetrical. Swimming is really good, and walking is really good. Even fast walking is really good. But more where we've got symmetrical
Yeah,
coordination of
yeah,
the
and
muscles on
swim.
both sides. And then what we do when
Yeah,
we do specific spinal isometric exercises. So these aren't like your physical therapy exercises. We've got a shoulder injury. They print out some shoulder exercises. Everybody gets the same thing. What this is are specific spinal isometric exercises. Now, isotonic is exercise with motion. Isometric is exercise without motion. And exercise without motion, isometric, is much more effective than isotonic. It actually affects those core muscles really well, and just works a lot better. So what we do is we base our specific spinal isometric exercises on the patient's x-rays. So what we're actually doing is teaching the patient how to adjust themselves by doing these exercises. And it takes 90 days to develop muscle physiology. There's just no way to speed that up. The problem too is that with isotonic exercise, you're doing it for a day, then you're resting it for a day, then you do it for a day, rest it for a day. Isometric exercises have to be done every single day in order for them to be effective.
side planks have been a great isometric exercises that some clinicians have shown results with X-rays in clinical environments. The side plank, obviously, for scoliosis, and then now I'm exploring kind of the front planks for that. I'm curious, what you mentioned you weren't a fan of push-ups. Do you have something that you like doing better, especially for maybe a kyphotic forward head posture?
Doing a bicycle exercise, I showed you how to roll up the towels for the neck and the lower back. Well, if you roll those up, put one in the neck and one on the lower back, and then bring your feet up and bicycle, that's really good because what we're working on are the internal and external oblique muscles, okay? So they kind of run sideways like that Chinese finger pull, and that's really effective as far as working the abdominal muscles. Yeah, and that works really well. Again, swimming is one of the best things that you can do. Walking, any type of aerobic. I've got a stationary bike I do on a regular basis. Um, because we want that aerobic motion in there as well.
Okay. Well, yeah, that's some really interesting stuff. I think with the vibrational chair as well. That's something I'm certainly exploring as well, because I think that's quite a unique device. Can you walk me through what is that device and what the purpose of it is?
Oh, the scoliosis chair?
Which I believe was
What that
patented
is?
by the Clear Institute, right?
Yeah, that's a chair that I invented a number of years ago. And what it does is first it stretches the spine, okay? So it decompresses it, and then it also has vibration on it, and the vibration has to be at 30 hertz at zero point 0.3 Gs. That's really important to have the right amplitude and frequency. The other thing is if you go to clear-institute.org, our website, you can type in exercise, and there's some pretty good general exercises that you can do for scoliosis on that website. Ones that are good in general without hurting the body. So
Amazing.
it's www.clear-institute.org.
Perfect. Okay. Thank you very much, Dr. Dennis Woggon, the originator of many alternative ideas that is preventing a lot of people bind their spine mechanically unnecessarily. There are the solution should begin with the most non-invasive approach first, right? But many surgeons, if you end up in the surgeon's office, their job is to consider whether you're a candidate for surgery or not. I think the goal of that person in terms of treatment isn't really about what's the best thing we can do for your spine. It's really like, should you get surgery or not? And I think that's, if you've ended up in that office, then that's that awareness that kind of is the situation in that office is an important piece that I
Right,
feel like it's not the end of the line. It's really only one alternative. And there are many alternatives out there. So, if surgery, surgery is for most people is not the be all and end all of these type of treatments. People have been developing so many alternative treatments, like Dennis that we've spoken to today. So, please, take the time to consider that, understand where that flexibility is, whether your curve is structural or not. Understand where these limitations are forming. Bring Give these exercises a chance. Things that, whether you do surgery or not, are still going to provide awareness and the skills, the breathing skills, the movement skills, the neuromuscular activation that you'll need anyway. Even if you do surgery, you'll still require these things to prevent the progression of the compromised part of your spine. So, that's what I have to say, Dennis. I really appreciate you coming on for this conversation. It's been very insightful.
Sam, thank you very much. I really enjoyed it. And like you said, it's always best to do the most conservative thing first. That doesn't mean that surgery is off the table, but at least, surgery is a thing that you can't undo. It's like I can get married, and if I don't like her, I can get divorced. Now, I've been married for 48 years, so okay. If I don't like a job, I can get a different job. But once you have surgery, you can't reverse that surgery. And if you do, there's all kinds of scar tissue and complications. So, yeah, always most conservative first.
Beautiful. All right. Thank you very much, Dr. Dennis Wogan.
Sam, thank
We'll
you.
leave it at that
Thank you
one.
so much for letting me on.
Absolutely. Thanks, everyone. We'll see you in the next episode.